Welcome everyone. Let's talk about an article that is based on a study done on the effect of azithromycin on the recurrence of wheezing in childhood patients who suffer from bronchiolitis. To continue, my classmate Heydy Mejia.
We start with introduction. Acute viral bronchiolitis is the most common lower respiratory tract illness among infants. A previous study has shown that viral bronchiolitis is significantly associated with subsequent development of recurrent wheezing and asthma in childhood. In the past decade, additional immunomodulatory and antiviral properties of macrolides have also been described. Macrolides seem to inhibit interleukin-8 production, reducing overall neutrophilic inflammation. Recurrent wheezing in young infants is characterized by a neutrophilic airway response. Recent previous studies have demonstrated a prolonged protection for subsequent recurrent wheeze and lower respiratory morbidity in infants treated with azithromycin during an acute respiratory syncytial virus bronchiolitis. Through the inhibition of the interleukin-8 inflammatory pathway. In the present study, we have tested the hypothesis that administration of azithromycin during hospitalization for viral bronchiolitis reduces the risk of subsequent wheezing episodes and hospital readmission, independent of the viral etiology. We continue with my classmate Miguel.
So, we are going to talk about the methods. The trial was randomized, double-blind, placebo-controlled trial. Acute viral bronchiolitis patients were recruited from the emergency department and hospital for 2 years. The total number of participants was 184 patients, but only 104 were qualified but by the telephone for secondary analysis after hospitalization during the period between discharge and up to 6 months after discharge. The inclusion criteria were being less to 12 months and admitted with prodromal viral symptoms in a first episode of wheezing or cancers with tachypnea. Be recruited with a 48 hours hospitalization with a maximum 72 hours history of lower respiratory tract clinical signs, wheezing and or respiratory distress. The exclusion criteria were any restriction of the use of oral macrolides, prescription of macrolide therapy by treating physical due to clinical and radiological characteristics, compatible with the diagnosis of chlamydia or Bordetella pertussis, respiratory infection. Third, previously diagnosed of chronic cardiopulmonary disorder, congenital acquired immunodeficiency, or neuromuscular disease. And finally, history of prematurity or another neonatal complications. The selected participants were administered daily oral dose of azithromycin or a placebo for 7 days. To choose which patients will use the medication and who will receive the placebo randomly. The group of patients that will begin azithromycin will be referred to as 1, and the group that will be begin the placebo as a group 2. The placebo was and smelled similar to azithromycin. Identical medication vials were used. Additionally, infants enrolled in the study could receive additional therapies other than macrolides, prescribed by the attending pediatricians. A 6-month follow-up was carried out after the episode of acute viral bronchiolitis to identify recurrent wheezing and hospital readmissions, for which people calls were made 3 and 6 months after the initial acute event, and establishing to questionnaire was answered. The question that was, did your child wheeze again after a hospital discharge? Finally, the results were compared with wing groupers using chi-square, mean weight test, and the relative risk and calculate. To continue, my classmate Elissa Guachamin.
In the result, 104 infants fulfilled all eligibility criteria that have been included in the trial that evaluate the efficacy of azithromycin for acute bronchiolitis. In the total of patients successfully contacted in the follow-up 3 months after hospitalization, 52.85%, that mean 37 and 70 were in the azithromycin group. At 6 months of follow-up, they were able to contact 63 subjects. Positive samples for RSV were found in 65 and the 104 of randomized patients. Over the virus identifications were parainfluenza and influenza and adenovirus. In the patient included in the secondly follows-up analysis, RSV was identified in the 54.3% of the patients, but the study samples were able by direct immune influences, which does not allow the detect of rhinovirus and metapneumovirus. Recurrently, wheezing risk was significantly reduced in the infant and 3 months after AV episode. According to their results, in the 3 months of follow-up, the recurrence rate of wheezing in the azithromycin group was 19.1%, where in the placebo group it was 39.5%. At the 6 months of follow-up, there was no significant difference between the two groups. In the group that used azithromycin, 55.6% had recurrently of episode of wheezing, while in the placebo group, in those one 27.3%. Continue to my classmate, Steve.
In this study, a significant association was found between acute viral bronchiolitis and the subsequent development of recurrent wheezing and asthma in childhood, which supports previous research that has demonstrated this relationship. One important finding of this study is that the administration of azithromycin during hospitalization for acute bronchiolitis showed significant benefits in reducing subsequent wheezing at 3 months after hospital discharge. However, this protective effect was not observed at 6 months after discharge. These results suggest that azithromycin may have a role in the management of acute bronchiolitis, but further research is needed to confirm these findings and determine the optimal dosing and duration of treatment. It is important to know that macrolides, including azithromycin, have both antibacterial and immunomodulatory properties, in addition to her well-established antibacterial effect. Macrolides have been found to additional immunomodulatory and antibacterial properties. These properties could potentially explain the observed benefits in reducing recurrent wheezing in this study. While the results are promising, it is important to consider the limitations of the study. For example, this study was conducted in a specific group of infants hospitalized for acute bronchiolitis, so the results may not be generalizable to other patient groups. Furthermore, further research is needed to better understand the underlying mechanism and determine the long-term efficacy and safety of azithromycin in the management of acute bronchiolitis. Thank you, everyone.